Hello, I'm Jim Donaldson, a pediatric radiologist from Children's Memorial Hospital in Chicago, Illinois. Some radiology examinations require that a child hold very still and sometimes hold their breath to eliminate motion during a diagnostic examination or procedure. Sedation may be necessary in young children who cannot cooperate on their own. MRI, CT, and some nuclear medicine examinations, as well as interventional radiology procedures, are examples often requiring sedation. Below are pictures of a CT scanner and an MRI scanner, both donut-shaped machines where a child will be placed during their test. They each require that a child hold very still during the important parts of the test. Technologists monitor each image or picture at the scanning console during the examinations to ensure that the child is holding still and that image quality is good. Sedation or general anesthesia are usually necessary for children undergoing interventional radiology procedures because they are more invasive and also require that the child hold very still. Shown here are two radiologists preparing to perform an angiogram on a child in the interventional radiology suite. The child is under general anesthesia. What is the difference between sedation and general anesthesia? There is a continuum from very light sedation to deep anesthesia. The term sedation usually refers to lighter sleep, while anesthesia is generally deeper. Anesthesia is usually required for longer or more invasive procedures and for children with complicated medical problems. The doctors responsible for sedation or anesthesia will determine what is most appropriate for your child. How are sedation and anesthesia given? Medications may be given orally as a liquid or pill, through an intravenous line, or by an intramuscular injection. General anesthesia often combines all of these routes of medication administration as well as inhaled gases to achieve the appropriate level of anesthesia needed. The picture shows a typical area where sedation may be given with appropriate heart and breathing monitors, oxygen, and other supplies to provide for safe sedation. What radiology tests do not require that a child undergo sedation? Plain X-rays, studies of the intestinal tract such as upper GI or barium enema, and ultrasound. Here is a picture of an ultrasound machine that can take pictures like a movie camera and does not require that the child hold very still or undergo sedation. At what age will a child not need sedation for a diagnostic test? The answer is it depends. Some 5-year-old children may be able to hold very still and follow commands, but sometimes a 10-year-old cannot. Even the most cooperative and calm child may become anxious and frightened at the time of the examination. Depending on the procedure, a baby that falls asleep may not require any sedation. This picture is of a 6-year-old child calmly watching cartoons before a CT examination. How will I know if my child will need to be sedated? Most radiology departments will have designated personnel who schedule examinations and will talk with you about the need for sedation. You should feel free to ask whether sedation will be necessary. Depending on the child's age, sedation may be planned just in case, but can be canceled if it is not necessary. What preparation is needed prior to undergoing an examination with sedation? You will be given instructions about food and fluid restrictions, and you should follow the instructions explicitly. You will be told when and where to show up. Expect to spend additional time because of the preparation necessary and recovery after the examination has been completed. How long is the recovery? Recovery can vary from only a few minutes to several hours depending on the type and the amount of sedation given. Sedation adds complexity to performing some radiological examinations in children, but may be necessary to obtain the highest quality. Radiologists need the examinations to be optimally performed so that they can make accurate diagnoses. Thank you.